Hello guys. This is Dr. Rizwan Mirza. Welcome to my channel at Urologist.
Let's discuss one of the important vitamins, that is vitamin D. Vitamin D is a fat-soluble vitamin that plays a crucial role in various aspects of human health. Let's discuss vitamin D metabolism. The main source of vitamin is sunlight, where UV rays convert 7-dehydrocholesterol, found in skin, into cholecalciferol, that is vitamin D3. Besides sunlight, vitamin D can be consumed in two forms: cholecalciferol, that is vitamin D3, from fish and eggs, and ergocalciferol, that is vitamin D2 from mushrooms and yeast. Both these forms of vitamin, that is ergocalciferol, vitamin D2 and cholecalciferol, vitamin D3, are biologically inactive forms of vitamin. They combine with vitamin D binding protein and are transferred to liver, where they are converted by 25-hydroxylase to 25-hydroxycholecalciferol, also called calcidiol, which again combines to vitamin D binding protein and is transferred to kidneys to be converted into the active form of vitamin D, that is 1,25-dihydroxycholecalciferol, also called calcitriol, by an enzyme called 1-alpha-hydroxylase. The last step of converting 25-hydroxycholecalciferol or calcidiol into 1,25-dihydroxycholecalciferol or calcitriol via 1-alpha-hydroxylase is regulated by PTH, which promotes this conversion. While fibroblastic growth factor 23 and excess calcitriol itself sends negative feedback to this conversion to stop converting vitamin D into its active form. This regulation depends on the calcium and phosphorus levels in the blood. So, to summarize, vitamin D can be taken via sunlight, where 7-dehydrocholesterol is converted into cholecalciferol, or it can be consumed directly in forms of cholecalciferol, vitamin D3, or ergocalciferol, vitamin D2. These inactive forms are taken to liver by vitamin D binding protein and are converted into 25-hydroxycholecalciferol or calcidiol, which is taken to kidneys via vitamin D binding protein and is converted into the active form of vitamin D, that is 1,25-dihydroxycholecalciferol or calcitriol via 1-alpha-hydroxylase. Wondering which form of vitamin D is measured in lab? It is 25-hydroxycholecalciferol, that is calcidiol, which can be measured via blood testing. Let's discuss some of the functions of vitamin D. Number 1. It promotes calcium and phosphorus absorption from intestine, which enables normal bone mineralization. Number 2. Adequate vitamin D is necessary to prevent conditions like rickets in children and osteomalacia in adults. Number 3. Vitamin D is believed to play a role in supporting the immune system and may help reduce the risk of infections. Number 4. Maintains normal cellular growth and function. So to summarize, calcitriol promotes absorption of calcium and phosphorus via intestine, and promotes calcium absorption via kidneys. In bone, it promotes bone formation and growth. It sends negative feedback to the parathyroid gland and reduces PTH production and parathyroid growth. Vitamin D levels interpretation. Calcidiol levels measured in labs are considered sufficient when they are more than 30. They are considered insufficient when they are between 21 to 29. And they are considered deficient when they are less than 20. Let's discuss vitamin D deficiency. Vitamin D deficiency can lead to a range of health problems, but mostly two problems are the main that include rickets and osteomalacia. Rickets. In children, vitamin D deficiency can lead to rickets, a condition characterized by weak and deformed bones. Osteomalacia. In adults, vitamin D deficiency can cause osteomalacia, which is marked by muscle weakness and bone pain. Vitamin D supplementation and replacement. In cases of deficiency or insufficiency, vitamin D supplements may be recommended by healthcare professionals. In vitamin D insufficiency, 800 to 1,000 units are given daily. In vitamin D deficiency, 50,000 units are given weekly for 6 to 8 weeks, then 800 units are given daily thereafter. Vitamin D levels are followed in 3 to 4 months. It must be strictly noted that a person must not take excessive doses of vitamin D, as excessive intake can lead to vitamin D toxicity. Let's discuss vitamin D in chronic renal failure patients. The patients with chronic renal disease are deficient in active vitamin D, due to inability of kidneys to convert vitamin D in its active form. Preferably active form of vitamin D is given in renal failure patients. It is available in both forms, that is tablet and injection. In vitamin D insufficiency, 50,000 units per month is given orally for total 6 months. In mild vitamin D deficiency, 50,000 international units are given weekly for 4 weeks and then 50,000 units per month are given orally for total 6 months. In severe vitamin D deficiency, 50,000 units per week is given for initial 12 weeks orally and then continued as 50,000 units per month, for a total duration of 6 months. Vitamin D levels are followed after 6 months. Remember that excess vitamin D intake can lead to vitamin D toxicity, so it is advised to follow a health care professional before taking vitamin D in any form. If you have any questions or query, do leave us a comment.
Subscribe to my channel at YouTube at Urdu and press the bell icon for updated video. You can also follow my page at Facebook and follow me on Instagram. And if you like the video, don't forget to like and share the video.